Hello, everybody. Dr. Maryellen here to continue my Women's Health webinar series with webinar number 3. We're going to be diving into the Ovary-Adrenal-Thyroid Axis. So on the agenda for this webinar, talking about that OAT axis, what it is, symptoms that you may be experiencing, testing options that I offer in clinic to my patients, of course, foundations of treatment, so what you can start doing in terms of ovaries, adrenals, thyroid, and ensuring balance and happiness in all of that, that whole system. And of course, stay tuned to the end if you are watching this live for a free giveaway and another promo that you can enter. So thank you for joining, and let's dive right in. So that ovary-adrenal-thyroid axis, that intricate communication and signaling that happens between these three organ systems. And it's so often that we become hyper-focused on treating only one part of the problem. So how often have you heard it's just adrenal fatigue, or it's just hypothyroidism, it's just estrogen dominance? I cannot stress this enough, but we cannot look at hormones in isolation. The bigger picture is key here, and truly, that transformation that takes you from getting those lasting results in treatment once we piece it all together and figure out exactly what's happening beneath the surface. And the ovary-adrenal-thyroid axis is truly a cornerstone of hormonal imbalance and a cornerstone of treatment in my practice. It's always something that I'm taking inventory of and seeing how it is responding in your body. I like to think of it as a three-legged stool. So you can imagine in a three-legged stool, if one leg is knocked out, so if one system is out of balance, it's only a matter of time before the other two legs start to give out as well, because it's only a matter of time before we can't balance and we can't rely on the optimal functioning of those two systems if one is implicated. And factors that can contribute to an imbalance in your ovary, adrenals, or thyroid: inflammation, poor sleep, stress, poor digestion or poor food choices, blood sugar irregularities, endocrine disrupting chemicals. So really all of these things that are common themes and common disruptors of good health, they really do play a role here. If the ovaries, adrenals, and thyroid stop communicating effectively, you will start to experience symptoms. And this is very, very common in my ladies in the menopausal years. And this is because as you are experiencing significant changes in the function of your ovary, so as your ovary stops to ovulate every month, there's a shift in the levels of estrogen and progesterone that are produced there. As those levels decrease slowly, your adrenal glands start to pick up the slack. So your adrenal glands take over for the majority of your sex hormone production. So as if your adrenal glands weren't stressed enough, being responsible for responding to stress and creating that cortisol hormone, now they have to worry about creating the sex hormones too. So you can imagine it's only a matter of time before you start to experience potentially subclinical thyroid issues as well. Overall, exaggerating the symptoms that you're experiencing. Now, I have two examples of systems because I thought that would be helpful for you guys to see exactly how the ovaries, adrenals, and thyroid communicate and respond to one another in the normal functioning of your body and your hormone production. So we'll start off with your thyroid hormone conversion. So once TSH from your brain signals to your thyroid, let's make some thyroid hormones. The thyroid hormones that your thyroid makes are T4 and T3. T4 is the inactive thyroid hormone that is converted into T3 to become biologically active. So we want T3. This is our moneymaker here for good thyroid function. In times of increased stress, so abnormal cortisol secretion, estrogen dominance, so if we have some issues with the way our body is secreting, metabolizing, detoxifying our estrogen, we are going to make more of this reverse T3. Now, reverse T3 is metabolically a useless hormone, so it's inactive and doesn't really have any impact and effect on our overall health other than stealing from that T3 pool. So we want most of our T4 to go here into T3, and we want very, very little of it to go into reverse T3. So these are hormones that you're going to see on my wish list of what I like to test in all women who I feel are having hormonal issues. Because I want to see what level that reverse T3 is at. It can tell me a lot about your adrenal glands, stress levels, and what can be done to support that ideally. And so, you know, too, when we're dealing with the thyroid, when you have lower amounts of T3 and T4 for that matter, so the lower these numbers are, the more slower or hypothyroid you are. When these are very low, this sends a signal back to your brain to produce more. Your body wants more of them. And in turn, that creates a higher TSH. So when we're hypothyroid, we have a higher TSH. And TSH is one of the common thyroid blood work tests that can be ordered from your medical doctor. So you might see if you've had routine blood work done with your family doctor that TSH was on there. Now, another phenomenon that happens, another thing that goes on between the signaling of our sex hormones is the pregnenolone steal. So pregnenolone is a precursor to our sex hormones. It's created from cholesterol, which is the backbone of all of our sex hormones. So in times of constant stress, chronic stress, and keep in mind, stress is not always that mental, emotional piece. We do have physical forms of stress, so pollutants, food choices, inflammation, all of these types of things can be perceived as stress in our body. We are pulling everything in this direction. So creating more cortisol. Now, when we create more cortisol, we are stealing from our progesterone stores. Our DHEA, testosterone, and estrogen become lower. So as you can see, when we're in that high stress, we're stealing from these precious resources that are truly the backbone to hormonal balance. And this is often what I'm explaining to patients if they've noticed that when they're super stressed or they have a change in routine, or something significant happened, if they recently lost a loved one or had a serious job change or things like that, more stress, they're not getting their period, or their period's really late, or their period's really heavy and painful. We can thank the pregnenolone steal for that. So once again, that connection between our adrenals and our ovaries. So pretty cool systems going on here, and patterns, things that I look at and that are interesting for you to know about, to know what's happening in your body. So symptoms that you may be experiencing that we see are a result of that OAT dysfunction. Sleep issues, so difficulty falling asleep, staying asleep, or not feeling rested when you wake up, depression or anxiety, chronic fatigue, pain, irregular or heavy periods, even painful periods, hypoglycemia, or symptoms of low blood sugar. So that could be feeling dizzy, feeling hangry, having cravings for sugar, or a voracious appetite, tender breasts, hair loss, skin changes such as dry skin, mood swings, those sugar or caffeine cravings, headaches, irritability or feeling hangry between meals, lightheadedness or dizziness from changing positions, almost like a vertigo if you've ever experienced that, weight gain or changes in your weight, and if you're catching colds and flus often. So these are all symptoms that there are some irregularities happening. Testing. So these next few slides might look familiar if you've watched my Owning Your Cycle Women's Health webinar series, the very first one I did, but very, very valuable to revisit, because as a naturopath, I am able to assess and test your hormones, your nutrient status through 3 different mediums, through blood, through saliva, through urine. So let's go right ahead and talk about blood tests that I'm recommending if I want to assess that ovary-adrenal-thyroid axis. So looking at a complete thyroid panel. So not only TSH, which is commonly ordered by your medical doctor, but taking that one step further and seeing that free T3, free T4, your thyroid antibodies, your reverse T3. So taking a very, very in-depth and comprehensive look at what's going on with your thyroid. That estradiol and progesterone, free testosterone, DHEAs, and FSH-LH. So these are your hormones, more so your reproductive hormones, androgens that I'd be looking at. Blood sugar investigations are very useful as well. So fasting glucose, HbA1c, which is an average of 3 months of your average blood sugar, and fasting insulin. Now I can also test your hormones through saliva, and that gives me an indication of the active level of hormone that is acting at the level of the tissue. So once it leaves the blood and it's carrying out its intended function in your body, the saliva gives us an indication of that. So how much of the active hormone is actually carrying out its intended purpose in your body. So this is very, very useful. Even to guide bioidentical hormone treatments. So if we were curious about a saliva hormone for your reproductive hormones, your estrogen, progesterone, testosterone, DHEA, and cortisol, cortisol is very well tested through saliva and urine. I rarely test it through the blood, but it is available. But if we were to look at those hormones through saliva and we were still curious about your thyroid, I would then also layer on a thyroid test in the blood just to make sure that everything is checking out. Same goes with urine. So urine offers us some of the most comprehensive looks at your hormones. So I've talked about these tests before, but in the urine, we're able to test something called metabolites. So metabolites are different byproducts at each step of your body's hormone production, the metabolism, of them in your body. So how your body is using them and the detoxification of them through your liver. So this is very helpful if we're wanting to get that full, most comprehensive look at exactly how your body is creating, using, and converting these hormones. Once again, although we can't test, this test does not include thyroid markers particularly or specifically, we are able to easily add on some thyroid investigations too. And usually when we're testing the urine, there is some interpretation of what your thyroid may be doing, because we're getting a really great look at your adrenal glands here. So adrenal function, your cortisol levels, that DHEA, and what's going on there. So really, really useful tools to help you understand what's happening at the root of the symptoms that you're likely experiencing. Now, foundations of treatment. So let's start off with the ovaries. So how do we support optimal levels of your reproductive hormones? And how do we ensure effective metabolism and detoxification of them so we're not getting those symptoms of painful periods, heavy periods, PMS, all of these things? So some treatments that I offer in my practice are bioidentical hormone therapy in terms of progesterone or estrogen creams, antioxidants to encourage healthy estrogen metabolism, so resveratrol, I3C or DIM, herbs like Vitex or chaste tree. They help that overall hormonal balance too between that progesterone and estrogen. Of course, things like an anti-inflammatory diet and balancing blood sugar are going to be foundational to overall balance with your reproductive hormones. Your adrenal glands. So when we are supporting your adrenal glands, we want to optimize the diurnal rhythm of cortisol. Diurnal rhythm means that in the morning, your cortisol should be at its highest, and then it has its slow curve decline, which is completely normal, and it should be its lowest before bedtime to help you get a healthy and restful sleep. By encouraging this diurnal rhythm and optimizing the release of cortisol, we are ultimately encouraging a healthy response to stress. So you can imagine if you've been experiencing stress for a long time, you might notice that your threshold for stress and your patience becomes a lot less. So something that might not have had such an effect on you, a few months ago or years ago, now is having quite significant impacts on your stress and mental health. And this is another symptom of chronic stress that we need to address. So to support your adrenal glands, I love to use adaptogenic herbs. So things like rhodiola, ashwagandha, holy basil, nutrients like vitamin C, RBs, so B2, B5, B6, B12, these are all important. Vitamin D as well, and supporting the body's circadian rhythm. So those natural sleep-wake cycles. Your body works on a clock, and there are certain times of day when your body's producing insulin, when your body's producing digestive enzymes, when your body's producing melatonin at its highest. So we need to make sure that we are supporting healthy sleep habits, supporting that cortisol release, so that we are optimizing that circadian rhythm. And the thyroid. So we are able to support your thyroid and support optimal functioning, and we can actually encourage that conversion, that favorable conversion of T4 to T3 by supplementing with essential nutrients, so zinc, selenium, iodine, L-tyrosine are some of them. As a naturopathic doctor, I'm able to prescribe natural desiccated thyroid if we feel that you may need that in your specific case. So this can be used as an alternative to some common thyroid medications such as Synthroid or levothyroxine, which contain primarily T4, that inactive thyroid hormone. Natural desiccated thyroid contains a blend of T4 and T3. So you're getting a little bit of that active thyroid hormone in there, which can which some patients respond very, very well to. So that is an option that we can discuss if we feel like your body needs that. Stress management and adrenal support, of course, are really important when we're dealing with the thyroid, and relieving inflammation and oxidative stress. So once again, looking at the bigger picture here and taking inventory of our symptoms and seeing which systems are impacted, where the imbalances are, we can really achieve great strides in your treatment when we start to understand and get the answers that we're hoping for, and troubleshoot and start to support your body with what it needs to achieve that balance. So thank you guys so much for joining me this evening. I've had such a fun time putting together these women's health webinar for you guys. For this week, I am offering you a free download, a 1-week thyroid health meal plan. So I'll be posting the link for you to download these delicious recipes. They're packed with those nutrients I mentioned. So that zinc, selenium, iodine, all those great things that we need for thyroid health. So I'll be posting the link to that in this Facebook group after the webinar. And my big giveaway as a thank you for tuning into my webinar series, and as a kudos to you for being inquisitive and taking that next step and investing in some knowledge and some extra resources to start moving forward and to get the answers you need to make some changes in your health. So I am offering a giveaway of a free visit, either initial or follow-up. So if you're a new patient, or if you've never, or if you're an existing patient of mine, this applies to you, plus a 10% discount on a saliva or urine hormone test. So a pretty big giveaway that I'm excited about. To enter that, comment on this video to let me know that you've tuned in, and you'll be entered. And you can tune in as many times as you'd like. I have one more webinar coming up next week, and I'll be announcing the winner on May 31st. So if you haven't caught the last 2 webinars, you can catch them on this Facebook group. And my last one coming up at the end of the month, next Wednesday, Radiate from Within, all about skin health. So another important focus of mine in clinic, and you can catch that at 7 p.m. in my Wellness Collective Facebook group. Thank you guys so much for tuning in. If you have any questions, please feel free to leave them for me, and I will see you guys next week. Take care.